Good evening, I'm Deborah Pinkerton. April is Head and Neck Cancer Awareness Month. Penn State Health experts are here to talk about the diagnosis and treatment options of head and neck cancer. Studies show that more than 59,000 Americans will be diagnosed with head and neck cancer this year. Screening and early detection save lives. Many head and neck cancers are treatable with surgery and/or radiation if they are found early. Now, doctors will answer some very important questions like, what are the signs and symptoms of head and neck cancer? Why is screening important? And what are the latest treatment options? And if you have questions at home, Donna Kirker-Morgan is here to tell you how to get them answered. Hi, Donna.
Hello, Deborah. Yes, those are such important questions, and we are up live with our web chat to get those answers given to you, the viewers. Tonight's expert is Dr. Guy Slonimsky. He is the head and neck surgeon at Penn State Health, one of many, and he is here to answer your questions up until 8 o'clock. Thanks for joining us. And if you would like to submit a question, you can go to abc27.com/head and neck. So get those questions in. The meantime, it's back to you, Deborah.
And thank you, Donna. As we mentioned, April is Head and Neck Cancer Awareness Month. A Lancaster County woman wants others to be well aware of one of the risk factors for head and neck cancer. Melissa Baker shares her journey.
If you're a smoker, stop. Speak for yourself. You will feel so much better.
A strong message heard loud and clear from 45-year-old Melissa Baker. Her journey began as a teenager when she started smoking for a number of reasons.
Right. Just wanted to do it and try it.
Melissa smoked 1 to 2 packs a day. Over time, she developed symptoms that she blamed on the cigarettes.
I couldn't swallow. I had a lot of trouble eating. A lot of pain in the right side of my ear, going down the side of my neck.
A key part of any evaluation is really getting that history. So, we talked about a lot of our risk factors. And then, the nice thing about what we do is we're able to get cameras in while patients are awake, so we can put a camera in the nose and take a look directly at the back of the throat and the voice box. And in doing that, we saw a mass there. We saw something that didn't belong.
A biopsy confirmed larynx cancer. The Penn State Health Head and Neck Cancer Team provides support to patients receiving this news.
These patients require a lot of emotional support, and that's what I'm here for, to kind of bridge the gap between the medical diagnosis and the caring part of taking care of patients and the emotional support.
Support needed when patients hear the recommendation from a doctor.
Based on the size and also based on the fact that she wasn't really speaking all that well, based on the fact that she wasn't really swallowing all that well, we had recommended removing the voice box. And that's never something we take lightly. We're taking away potentially someone's ability to speak and communicate with the world. However, we also have to think about what's going to be the safest and give her the best chance of survival.
Initially, Melissa said no.
But I let him do it because I want to live. I trusted him.
When we talk about removing the voice box, we're literally removing the voice box. So we take out the larynx, we take out a portion of the trachea, and then we have to reconstruct the esophagus, which sits behind it, the food pipe, to create a swallowing tube for patients to swallow safely.
I was up 2.5 hours later walking around. I said, you're not getting me down, I'm getting up.
About 7 months later, Melissa had another very important procedure.
She has a tracheoesophageal prosthesis, or a TEP. And what that is it's a one-way valve that sits between the trachea and the esophagus. So the trachea is coming out to the neck after this surgery. And so when they cover the hole where the air is coming in and they breathe out, they can force the air through their food pipe and back through their mouth to create voice.
I got my voice like 2 months ago.
When asked how does that feel, she responded quickly.
Awesome.
It does give her a voice and allows her to, maintain as much normalcy as possible with the permanent removal of the voice box.
Melissa says her family and faith guided her through this unexpected journey, along with her determination to help others.
After your laryngectomy, you can go on living your life just as you were before. It's so much better. because you feel better. Gotta be positive, stay focused on recovering, and keep going. Help others as much as you can, be inspirational to them.
And Melissa is such an inspiration to so many people. After surgery, she did need chemotherapy and radiation. Today, Melissa says she feels amazing and she is so happy to have her voice. She really wants to provide support to others. And joining us right now is Dr. Neerav Goyal, Chief of the Division of Head and Neck Oncology and Surgery at Penn State Health, and also Melissa's surgeon. Really, what an amazing journey it has been for Melissa. So glad she's doing so well. Let's talk about smoking, about why that is. It's really something that you should stop doing.
100%. So there's been decades of research that really shows how smoking has been linked to different types of cancers, and it is one of the primary factors, risk factors for causing head and neck cancer. We've seen through multiple studies that stopping smoking can reduce the risk of developing a head and neck cancer significantly, even within the first year of smoking cessation. So we really advocate for all of our patients to stop smoking so they can eliminate and help minimize that risk factor in causing cancer.
Oh my goodness, so it really does drop as far as your risk. How is Melissa doing?
Melissa's doing great. You know, it's great to see that interview with her, and she's now close to 2 years out from her treatment, and she's remained cancer-free. And she's, as she mentioned, she's doing all the things that she loves. Her and her husband run a pool company, and she's enjoying being back in the water.
And you said that she's actually able to get in the water because of some things that you have done.
Right, yeah, you know, she has the prosthesis, she has the stoma, but there's apparatuses that she can wear that help protect her breathing while she goes in the water.
So she is enjoying life, that's
Yes.
for sure. So there have been so many advancements in how you help patients with laryngectomy care. Why don't you talk to us about that?
Sure, I think as we saw in the video, the greatest thing that we've been able to provide patients is the ability to restore communication and restore their voice. And doing a laryngectomy and removing the voice box, we remove the way that people are able to communicate with the world. Putting the prosthesis in helps restore that, helps give them a voice that's somewhat natural but monotonous.
And you really are at the forefront of as far as finding new devices for patients and trying to find out which ones really work best.
100%. So, you know, one of the areas of research is ways that we can try to create a more natural sounding voice. So one of my partners, Dr. Slonimsky, who was on the show earlier, is really helping lead the forefront there.
Let's talk about robotic surgery. That's something that we always hear about. Tell us how it's used for this type of surgery, and how do you really determine who would benefit the most from it?
I think about robotic surgery as one of the many tools that a surgeon has in approaching cancer. So not every patient is a robotic surgical candidate, but we evaluate every patient to see if the tumor is in the right spot, in the right location for us to offer robotic surgery and offer them the best chance of a cure through a minimally invasive approach that allows us to allows patients to recover faster with less pain and leave the hospital sooner. One of the unique things about Penn State Health is we're one of the few hospitals in the state of Pennsylvania that has access to some of the latest tools in robotic surgery, such as the Da Vinci SP.
And let's talk about the recovery.
The recovery is significantly improved in those patients that are approachable with a robotic tool. We're able to do the surgery through less invasive approaches, less bleeding, and offer quicker recovery in and out of the hospital.
And that's certainly something patients want to know. Now, Penn State Health has really expanded all over central Pennsylvania and beyond. How is this beneficial to patients?
Our goal is really to be able to provide cutting-edge therapies, whether it's through clinical trials or through surgical advancements, to patients as close to home as possible. So we have opened up offices on the West Shore and by Holy Spirit in the Hamden Medical Center. We have our main hub at the Hershey Medical Center, and we have head and neck surgeons who are also seeing patients down in Lancaster. So this really allows us to provide patients care closer to home.
Right, and so it's not an hour drive, it may be a 15-minute drive.
Exactly.
Great. Dr. Goyal, thank you so much for all this information.
Thank you for having me.
And if you would like more information, or if you would like to make an appointment with the Penn State Health Head and Neck Cancer Team, you can call this number, 717-531-6822, or visit online at pennstatehealth.org. Let's check in with Donna Kirker-Morgan. What are some of the questions being asked tonight, Donna?
Well, Deborah, we have a wide range of questions coming in live to the web chat, and with us is Guy. Dr. Guy Slonimsky, and he is the head and neck surgeon, or one of them, at Penn State Health, and he's been very busy tonight. We're going to start with our first viewer question, and this viewer writes, I have a sore throat and hoarseness for a few weeks. Should I be concerned, or is this serious?
So every sore throat and hoarseness, specifically in an adult that lasts more than 2 or 3 weeks, usually we recommend having an evaluation starting with a primary care physician or seeing an otolaryngologist to take a look at the oral cavity and throat, especially if these symptoms are not associated with high fever and general malaise. That could be more significant with like, for example, strep throat or acute viral infection, COVID or influenza, for example. And if these symptoms last more than 2 to 3 weeks, then we definitely recommend evaluation of the oral cavity. And sometimes for these patients, we also perform an in-office endoscopy to take a look at the vocal cords to rule out any lesions on the vocal cords that could lead to these symptoms.
So do take it serious, especially if you don't feel like you have the flu or something else.
Yeah.
Thank you very much. We're going to continue with more questions with the doctor in just a bit. But if you would like to submit a question, go to abc27.com/head and neck. Stay with us. We'll be right back.
You're watching Let's Get Ahead, curing head and neck cancer together on ABC 27, sponsored by Penn State Health.
Welcome back. Joining us is Dr. Emily Funk, head and neck surgical oncologist at Penn State Health. Thanks for being with us.
Absolutely.
Let's talk about the signs and symptoms of head and neck cancer.
Absolutely. So most commonly, people come into our clinic when they notice something like a growth or a lump in their neck on one side, sometimes with the ear pain that's been going on for quite a while. Other times it might be something like hoarseness or a change in their voice, or pain or difficulty with swallowing or eating. And other times it might be something like pain in their mouth or a sore, an ulcer that won't go away somewhere in their mouth or their throat.
So if you're experiencing any of these symptoms right now, Penn State Health has a free head and neck cancer screening. Talk to us about that.
Absolutely. So the screening event is a wonderful way for us to bring in the community and anybody who wants to come in to provide some information on the different signs and symptoms of head and neck cancer, and to do a physical exam and evaluate patients for these types of things. It also allows us to provide more information on things like the HPV vaccination, smoking cessation, and other tips and tools and tricks we have for helping to avoid cancers in the future.
And who should attend this?
Most commonly, people who get head and neck cancer are people who have a history of smoking, as we discussed. Also, people who have daily alcohol use, chewing tobacco, or anyone who's having any of those symptoms of things like hoarseness or ear pain, neck growths, lumps, bumps, things like that.
So if you find something at this screening, what's the next step?
So most commonly, we would set somebody up for a follow-up visit with one of our providers. That would allow us to perform a more dedicated examination with a flexible laryngoscopy or a scope exam, to order imaging or to determine if a biopsy is needed.
Let's talk about HPV and head and neck related cancers. We hear that they are on the rise. Are they common?
Absolutely. So HPV, or viral-induced malignancies in the oropharynx, so the tonsils or the back of the tongue, is becoming a much larger problem than it has ever been. Over the past decade, we've seen significant increase in the number, especially of young men in their mid-40s and 50s who are getting this type of cancer secondary to the HPV virus. And so it's actually something that's been surpassing the amount of cervical cancer that is secondary to HPV, because they have things in place like getting a pap smear to prevent and to screen for that, where we don't have the tool for that for early identification of this tumor, to allow to detect it and have diagnosis early.
So if someone is diagnosed with head and neck cancer, how do you decide what is really the best treatment for them?
So anybody that comes in, obviously the earlier the better, and so we can determine based on kind of their staging after their workup is completed, what is necessary. But I always talk to everybody about the 3 tools that we have for cancer treatment. surgery, chemotherapy, and radiation treatment. And we can use any of those three in combination or alone, depending on their exact diagnosis and the findings on exam and on imaging to determine an individual treatment plan. We also work with a multidisciplinary team of doctors within our field, within the chemo doctors, the radiation doctors, the surgeons, and our pathologists. We all discuss our patients and make an individualized treatment plan for each of them.
Yep, so it is personalized. You're going to treat it what you feel as though is the best treatment for that patient.
Absolutely.
Dr. Funk, thank you for this information tonight.
Yes, thank you for having us.
And once again, the free head and neck cancer screening is Tuesday, April 8th from 6 to 8 in the evening. The screening is taking place at the University Physician Center at Penn State Health Hershey Medical Center. You need to call 1-800-243-1455 to register. Now let's check in with Donna and get more answers to our web chat questions. Donna.
Okay, Deborah, back with us is Dr. Guy Slonimsky. He is head and neck surgeon with Penn State Health, and he's been answering questions all evening on our live web chat. So we're going to give you one of those questions right now from our viewer. This viewer says, my dad was just diagnosed with throat cancer. What questions should we ask to make sure we find the best doctor for him?
So I would start with asking the primary care physician for who to place a referral for. Most of our referrals come from the primary care physicians' offices, so they are well familiar with the subspecialties in their region for which they can refer patients to. Second, nowadays in the era of the internet, everything is available online. I would highly advise for patients to go into the websites of the main academic centers and look for the departments that treat head and neck cancers within laryngology. All our portfolios are available. All the surgeons, you can read about them, you can check their ratings. And actually our department have a website that you can go in and look into the surgeons and their subspecialties. So all the information is highly available. Second important source is word of mouth. Friends, families that were treated for head and neck cancers could recommend physicians that they were treated by.
And this viewer is asking, what are some other risk factors to watch out for with head and neck cancer?
So I would start with the first most common risk factors, which are smoking and alcohol consumption. Nowadays, as was mentioned by Dr. Funk, the HPV virus, which is not rare at all.
That's growing.
That's growing. This is something that
the incidence,
it's on the rise, especially during the last 2 or 3 decades. It's a virus that's very common in the population. Most people will clear the virus, and a small subset will be a carrier, and a small subset within this population will eventually develop cancer. Other risk factors are, for example, if we take into consideration, for example, skin cancer, so sun exposure. Family history is a strong predictor, especially in thyroid cancers. There are rare genetic disorders and syndromes that can lead to head and neck cancers, but these are very rare.
So look at your family history, that could play a part. And how do patients usually present to you? Is it usually a lump or is it usually the sore throat?
So it depends. Many patients present with a neck mass. Some present with difficulty with swallowing, hoarseness, difficulty with speech. Many are found incidental. For example, with thyroids, most of the thyroid nodules are found because someone has a scan because of a neck pain, for example, or have just a routine ultrasound for something else, and then they see a thyroid nodule, we send them for a biopsy, and cancer is diagnosed. So nowadays, there is no like one hallmark. Neck masses, ulcers in the oral cavity, for example, painful ulcers, or something that was seen by a dentist.
So dentists are, they do identify quite a bit.
Yeah.
Thank you so much, doctor. And it's still plenty of time out there until 8 o'clock to submit your question, and you can do that to abc27.com/head and neck. So get those questions in. In the meantime, we're back with Deborah.
Thank you, Donna. Joining us is Dr. David Goldenberg, Chair of the Department of Otolaryngology, Head and Neck Surgery, and cancer survivor Jeff Shoup. Thank you both for being with us.
Thank you.
Dr. Goldenberg, support is so important, and we know that Penn State Health has a support group for head and neck cancer survivors. Talk to us about that.
Well, this group is for survivors, by survivors and their caregivers, and it's incredibly important for people who are undergoing this new diagnosis or difficult treatment for head and neck cancer to have access to other people who are either going through it or have been through it, have done well, have not done so well, and their loved ones, and it's invaluable.
And I'm sure, Jeff, you can echo those words because as a cancer survivor, you are involved in the Penn State Health Head and Neck Cancer Support Group. Talk to us about that.
Yes. Well, when survivors come to our group, they get to see all the different people that are there. So that gives them hope. And then they hear the stories that could be very similar to theirs. So that gives them hope. And then they find out that those survivors have been there 10, 15, 20 years. So there is a life after treatment. And so we welcome the survivors and their caregivers, because we support both of them. And then you make the connections to someone that has already gone through what you're going through, and that really means a lot.
Yeah, absolutely. Especially you can talk to each other about the different symptoms that you may be experiencing or just getting through the next stages of life. So
can
absolutely.
Always contact them. Yep.
That is great. Dr. Goldenberg, let's talk about research and how important are clinical trials and why should patients get involved with them?
Clinical trials are crucial when you're dealing with a disease like head and neck cancer. Clinical trials are how we evaluate if a new treatment is as good, if not better, than a treatment we've been using for a while. And the only way we're going to actually win the war against head and neck cancer is through clinical trials.
And Jeff, you participated in a clinical trial.
Yes.
Why was that important for you to do that?
Well, at 2 years after my treatment, my cancer came back in my lung. And my oncologist said I had enough radiation, and he suggested that a clinical trial might be my best option. And it turns out he was right. In 2014, I entered a trial for a brand new immunotherapy treatment. And I did very, very well in that. So I've been cancer-free since 2015. So
congratulations.
Pardon me?
Congratulations.
Yeah, thank you. I feel that participating in the trial, clinical trials are a necessary step in the process. They could do simulations and they could use testing on animals, but that only goes so far. So clinical trials is the only way to really test the dosage amounts and the effectiveness of the drug and the new therapy.
Absolutely. Dr. Goldenberg, we want to talk about this major campaign that just kicked off yesterday. Let's Get Ahead, Curing Head and Neck Cancer Together. Tell us about that.
Yeah, so we have this fundraising initiative called Let's Get Ahead for Head and Neck Cancer Awareness Month. It's incredibly important. What we need to do is more outreach, more research, more education. And these things cost a lot of money. A clinical trial can cost tens of millions of dollars to complete. And that support is really important so that we can really kick this disease to the curb.
And Dr. Goldenberg, why don't you, or what message should I say, do you have someone who's been newly diagnosed with head and neck cancer? Why should they really reach out to you, seek the team there at Penn State Health?
So, you know, denial is an innate human trait, and it's a much easier to close your eyes and ears and pretend that everything's okay. If you have the signs and symptoms that my colleagues have outlined, and you think that you may have a head and neck cancer, it's really important that you get diagnosed early, because early diagnosis gives you a better chance of beating this disease.
Well, that's a wonderful message. Thank you so much, Dr. Goldenberg.
Thank you.
Thank you, Jeff, for sharing your journey with us.
You bet.
And we also send a special thanks to Melissa and Jeff for sharing their journeys, and you, our viewers, for sending in your questions. If you would like more information, or if you would like to make an appointment with the Penn State Health Head and Neck Cancer Team, call 717-531-6822 or visit online at pennstatehealth.org. Once again, the free head and neck cancer screening is Tuesday, April 8th from 6 to 8 in the evening. The screening is taking place at the University Physician Center at Penn State Health Hershey Medical Center. You need to call this number in order to register, 1-800-243-1455 to register. Also, Dr. Goldenberg just talked about the Let's Get Ahead campaign. You can support this year's campaign by creating or joining a fundraising team, giving a gift, or participating in the 5th annual Sporting Clay Shoot. All proceeds directly support head and neck cancer care at Penn State Health. The goal is to make great strides to prevent, diagnose, and treat head and neck cancers. To learn more and contribute to the campaign, you can scan the QR code right there on the screen. Hope you learned a lot about this Head and Neck Cancer Awareness Month. Don't forget about that free screening that is available. We want to thank you for watching tonight, and we wish you good health.